3, 2, 1, and... Hi, good morning. Maayong buntag sa inyong tanan. Good morning, everyone. This is Dr. Joff. And if you can hear me, comment in the chat below. We are going to talk about some of the questions that the AVN patients, the hip arthritis patients, some of them already had surgery, some of them did not yet have surgery. They have questions, and I'm here to answer some of their questions. So let me know if you can hear me loud and clear. Maayong buntag sa inyong tanan. Good morning if you're from Luzon, Visayas, or Mindanao. This is Dr. Joff Lordelis. And right now I'm here in the clinic. Just going to grab coffee. Hi, Sir Kent. Let me know if you're listening. So the first question, I'm just going to ask if you guys can hear me, and comment in the chat below. Let me know where you are from. Are you around the Cebu City area? Are you around the Visayas area or Mindanao? Comment in the chat below. I want to know where you are from. And once I know that someone can actually hear me, because last time I was doing a live, there was no sound. So it's happened more than once na walang sound po. So just want to make sure that I have sound. I just want to make sure that someone is listening. Again, this is a question and answer. I'm just going to do a really quick question and answer. For those of you who can hear me, please let me know if there is sound in this video. Good morning po. If you can hear sound, please type in the comments, yes, there's sound. Or if there's no sound, let me know. I'm going to start just after this coffee. Can you hear me, guys? Yep, I don't think there's any sound. So let me know if you can hear me. Comment in the chat below. Just say yes or no. And just gonna start. I prepared a little presentation because some of the AVN patients actually have these questions in mind. Yes, Doc, klaro kayo. Uy, thank you so much, Eugene Marie. Thank you so much. Let me know where you are from. Again, this is our AVN and arthritis portion of Ask Dr. Joff. For those of you who do not know what AVN is, it is one of the causes of hip osteoarthritis in very young patients. So here is what happens. This is actually the ball and socket hip joint. And what happens in AVN is there is a problem with the blood supply to the head. The head slowly dies. This can be from trauma. This can be from smoking, alcoholism, steroid use. There are many causes of AVN. But once the bone dies, the normal hip joint, you can see below, those are the arrows showing the normal hips. They're very round. There's joint space. So this is normal. It becomes abnormal. It becomes arthritic. No more joint space. This is very painful already. And it can happen in 20, 30 years old, severe arthritis. So painful that some of these patients already need what is called a total hip replacement. So in total hip replacement, we replace the ball and socket joint so that we can give these very young patients quality of life to do what they want, to go back to work, to travel, and to have less pain. So we're going to do a live session for hip replacements, hip arthritis, and AVN this Sunday, 8 p.m. I hope you can join us here in the Facebook page. Now, this is a question from one of the AVN patients who've already had a hip replacement. Because when you have a hip replacement, the doctors give you precautions, bawal to, bawal yan. And these precautions will prevent yung tinatawag na hip dislocation. We don't want that to happen. So a lot of the patients are scared. They do not know what positions they can and cannot do. So this is the question, a very valid question. Guys, sorry, napaisip ako. Adult question. After operation, kailan pwede makipag-make love? And ano yung mga positions for making love after a total hip replacement? This has already been studied by many doctors. Sexual activity after a total hip replacement. This is a capture study, and this is showing you the different positions na ginagawa, and alin dito yung positions na pwede, alin dito yung positions na hindi pwede, alin dito yung positions na bawal, no? So this is what the questions is going to answer. And for blue, just want to make sure that blue means yung lalaki, pink is for the ladies, and we have positions 1 to 12. And in the next slide, I'm going to show you which positions are actually okay and not okay for yung tinatawag, yung tinatawag na hip replacement. Sorry about that. Naputol. So anyway, I hope you can see this. There's a technical difficulty. But yes, I'm showing you in check marks. If you are a lady, if you are a guy. So again, may designations, which positions are okay for the guys and which positions are okay for the girls in making love after a total hip replacement. So take note at position number 3, if you are a female, bawal po yan. If you are in doing position number 5, position number 8, bawal po yan sa dalawa. So yung position 8, you see the 2X there. So very valid. Please study this kasi not everything is okay. And it doesn't mean that you lose quality of life after you get a hip replacement. Again, you always need to ask your doctors po, because the first 3 months after hip replacement, dyan po you need to ask your doctor because you are scared of these dislocations. You have these precautions. And most of the time after the 3 months, the doctors will let go of these precautions. So always ask your doctor. This is a general guide, not to be used just by everyone. And another valid question. Hi Doc, ask ko lang po, okay ba itong position pag may hip replacement ka? Can I pray like this? If so, Muslim prayers, our Muslim brothers would like to know if they can do a prayer position after hip replacement. Again, it is always best if you ask your doctor. But in most cases, after hip replacement, yung Muslim prayer can be resumed. So if you did a certain procedure, I do it through a direct anterior approach. That means no muscles are cut, no? I do allow positions like this. And these are studies showing you that before total hip, it's impossible for patients to do the prayer. It's very difficult in 31%, impossible for 48% of patients. But after the total hip replacement, the studies are showing 89% were able to do Muslim prayer and only 11%. So, depende ulit yan sa inyong doctor. It depends on your doctor. It depends on perhaps what he did. And sometimes there's also impingement. That's why it's not always 100% pwede sa lahat. I always stress, always ask your doctor. And that's all the time I have for today. You can see me in Robinson Cybergate if you have any more questions for a consultation. So this is Dr. Joff. Just message me if you have concerns, questions, comments. And I invite you here in the Facebook to do the live with me, question and answer more about the AVN and hip arthritis po. Much love and respect. This is Dr. Joff. I'll see you in the future. I hope our paths cross again. Bye-bye po.